Okay, welcome back, everyone, to One Body. I'm Cruzy,
I'm Eden.
and today we're joined by Shannon Duffy. Thanks, Shannon, for coming.
Thanks, guys, for having me. This is so exciting.
Yes, so Shannon is a PA, physician assistant, and we both went to Emory together for PA school, throwback. And she's doing cosmetic and medical dermatology, which is amazing and very applicable to like everyone in the world, but specifically our age group, females. I feel like we do deal with a lot of dermatological issues. So we have a bunch of questions for her, but today we're going to focus on acne. Just everything that pertains to acne. We're going to bust some myths around acne that might be floating around social media, learn about what it is, and pick your brain. So we're really excited that you're here.
You have beautiful skin. I can tell you
Thank you.
work in derm.
Thank you. Actually, I've gotten so much hyperpigmentation this summer just because Colorado's so sunny. And I
Ooh.
got a puppy. So we've been
Wait, I didn't
outside
know that.
all the time. Yeah. I have a 5-month-old golden retriever.
Oh my goodness.
Yeah. So we've been spending so much time outside. And no matter how much like protective use I do, I just am a hyperpigmentation girly. So
Yep.
I am set to do actually a few laser series this winter, and I'm excited to see kind of how that goes.
We should do another one on melasma.
We honestly should. That's so common. And
Yeah.
there's so many misconceptions. Even just like blue light from your device is going to make your melasma worse.
Oh gosh.
I
Uh-oh.
know, but no one thinks about that. Yeah.
Another reason to get off your screens.
You're a medical and cosmetic derm? Are those the two categories? Is it typical for those to be together, or are they often two separate scopes?
That's a good question. Most of the time, medical dermatology will offer some component of cosmetic dermatology. Cosmetic dermatology are things like filler, Botox, lasers, that kind of thing. But there are specific med spas or aesthetics places that just offer truly aesthetic or cosmetic things. But oftentimes, derms will do a little bit of both.
Okay. And does acne fall into the medical camp or cosmetic?
Good question. There's kind of a bit of an overlap. There are ways in which you can treat it from the medical perspective with pharmaceutical management. And then, as we'll talk about, there are ways in which we can address it from the cosmetic perspective, whether that's microneedling or lasers and that kind of thing.
Okay, what is one health or wellness habit that you swear by?
Okay, not acne related, and I hope that's okay. But
Yeah.
I've been on a big creatine kick lately. I read some research about like the muscle benefits, recovery benefits, mood, focus. And so that's something I've incorporated into my daily life, and it's been a game changer for me.
What have you noticed specifically?
Honestly, my focus has been significantly improved since being on the creatine. I'm able to like hone in with patients and really focus a lot more than I had been prior. And then I do notice quicker muscle recovery, which allows me for more intense workouts.
Okay.
Creatine, honestly, like the term creatine has always seemed like a male, like it's only for men or something, or maybe that's just how I've heard it. But I'm hearing of more women using creatine, and I love that. It sounds like it's helpful.
Yeah, it's not just for men, but originally it was like marketed as such. So I definitely think it's something women should consider.
Yeah, I've never tried it, but I do think, especially like postpartum, I mean, I'm over a year out, but I still feel very brain foggy. So I'm wondering if it would help me. But
Yeah.
I am curious because I've heard people say that potentially it could cause acne. Do you know, like, have you heard anecdotally or read any research on that?
Not creatine specifically, but oftentimes those patients are doing protein supplementation mixed with creatine. And so it's more so the protein that we're seeing. There's just not data on if creatine causes acne, but it's certainly possible.
All right, so you work in dermatology. Did you always know that you wanted to work in dermatology?
So my background prior to PA school was only in dermatology. And so when I went into school, I came in with an open mind. This is the only piece of medicine I've ever touched. Like maybe there's something out there that I love even more than derm. And then very quickly at the beginning of clinical rotation year, I realized that I'm just a derm nerd and that is my passion. And so from there on out, I was like, only want derm if possible. It's just like, it's really neat to me. Like, I think a lot of people think about derm and they see just like the cosmetic aspect to it, which I do enjoy, but there is a huge medical component I don't feel like everyone thinks about. Like, there are a lot of internal manifestations that will present externally, like things like Crohn's disease, breast cancer, a lot of internal things. And oftentimes dermatologists are the first touch point for those patients. And it's kind of like this master puzzle. And I really love that.
Yeah. And you're the kind of person who works in derm you kind of mentioned this, but I see it so evidently. You are in it because you love skin and you love the medicine behind it. You're not
Love
just
skin.
like,
Such a weird thing to say, but it's true.
no, it's true. Like and you're also really nerdy. Like you were top of our class. Like you really know medicine and you're passionate about dermatology. It's not, I do think a lot of people go into derm because it can be very cushy. It's very
Mm-hmm.
lucrative. And you also get a lot of benefits sometimes for yourself of like treatment discounts. And generally a lot of people that work in derm like look so amazing because they have access to all these things. But I
Sure.
think like, I'm sure those things are a plus, but you are just passionate about the medicine and about the care that I know you provide. So that's why I wanted to talk to you specifically. I mean, there's like a million
Thank
people
you.
that work in derm, but I'm like, I know you personally, and I like the way you approach things, and I know you studied your butt off, so you
Thank
know a
you.
lot of good stuff. Yeah.
Yeah, I always joke with patients like I could be making zero money. I could be doing this just like as a volunteer gig and I would still do it every single day
Hmm.
because I love it so much.
Yeah, that's so awesome. What is one of the biggest myths that you see commonly on like social media or just out and about from friends that relates to derm that you want to bust?
Yeah, I work in Boulder, which is a very health-centric city. It's one of the healthiest cities in the entire country. And there's a huge, like, all-natural approach here with my patients. And so oftentimes I'll see people putting all, quote unquote, all-natural products on their skin, thinking that that's the healthier option, when sometimes in reality, it's just not the case. I know we'll touch on it in a little bit, but things like beef tallow for acne-specific patients can be a huge, huge, huge red flag. But the idea of it being all natural, people think that it's, quote, better for you. And that's not always the case.
Yeah, that makes sense. And also, there's no regulations around the word natural, right? So, like,
Mm-mm.
you
Mm.
can put natural anything. And, like, I know people are more aware now of the term like natural flavors that's found in a lot of food products because it's like,
Mm-hmm.
what does that even mean? Who
Yeah.
knows?
Yeah.
But on skin and like beauty products too, natural really doesn't mean anything. So,
Mm-mm.
that's a good one. That's helpful. Okay, so this is related to that. I have some rapid fire questions to start us off. And I want you, these are kind of like skincare trends that I see floating around. I want you to rate them 0 to 10 on like
Okay.
your opinion on if they're worth the hype or if they're not.
Okay.
0 being not worth the hype, 10 being worth the hype. Okay, beef tallow. Just give us like a little bit more about your opinion.
Acne prone skin, negative 100, 0, 0,
Okay.
0. Yeah.
What about the counter argument? If someone can tolerate it, is there any benefit to using tallow over a different kind of moisturizer? No.
No, there's no excess benefit. It's not going to harm you nor hurt you if you're not acne prone. So that's an entire like personal decision. But if you have acne prone skin, it's going to make it worse
And why is that?
because it's comedogenic or pore clogging. And that's,
Mm.
we'll talk about it, but that's like the initial step that causes acne to begin with.
Okay.
Mm.
I have heard this is from, not to put them on blast, but just because like people hear from different brands, different things. Do you know
Mm-hmm.
the brand Primally Pure?
Mm-hmm. Mm-hmm.
Okay, so they use a lot of beef tallow as their base.
Yep.
And I have heard them say specifically that beef tallow is more similar to the actual sebum that your oil glands produce in your face.
Mm-hmm.
And therefore, like it can maybe your face can soak it in better or, it works better with like, is there any merit to that or is that just marketing?
There's no current clinical data that proves that that's the
Okay.
case.
Okay.
So
Wow.
yeah,
All right. There we go. That's why
at
There we
least
have
that
it.
at least that
yeah.
I've read. Yeah.
Yeah, I've never heard of any data. I think it's just their theory on like why they use their products. And I will say, honestly, I use their products and
Mm-hmm.
I use beef tallow. It's worked for me, but my skin is very dry
Mm-hmm.
and it's not very acne prone. So I have said, like, if people ask me what I use, I say I'm using these beef tallow products from Primally Pure. But
Mm-hmm.
if you struggle with acne, I probably would not recommend it. So,
Yeah, that's a
yeah.
great disclaimer.
Yeah. Okay, how about hypochlorous acid spray? So the one that I keep hearing about, and also I'm just outing myself, have been using here and there is the magic molecule spray. So I see a lot
Mm-hmm.
of influencers like spraying it on their face after working out. What do you
Mm-hmm.
think? 0 to 10?
I think it has its place. I'd give it an 8. If
Okay.
you're not able to quickly cleanse your face or take a shower right after working out, and it's going to be some time in between when you can actually cleanse, spritzing on some of that hypochlorous acid spray will kill off some of the acne bacteria. So it can be helpful, but it shouldn't replace your cleanser.
Okay.
Is there any harm in using it?
If you have like a damaged skin barrier or you're a super sensitive skin person, it can cause irritation and inflammation of the skin. So kind of
Mm.
keep that in mind, but it does have its place.
So
Okay.
I feel like I don't know if it's specific to hypochlorous acid, but I was using it. I changed a few other things in my skincare, but my face was breaking out really bad. And I'm wondering if, like, for Cruzy, who doesn't have a lot of acne, if she's using it like preventatively. But for me, if I have a bad outbreak of acne, like maybe wait till my acne is a little bit more healed prior to using the acid or the hypochlorous acid.
I feel like if you have a minimal or like a mild outbreak, spritzing it on probably won't do too much harm to you. One of the things that's perpetuating your acne flare is inflammation or irritation of the skin. So if you're putting it directly on a big flare, then you technically do risk making it worse. But you're also simultaneously killing off the acne bacteria that is also perpetuating the cycle. So it's kind of a risk benefit. In that case, I always say it's kind of independent to the patient. It's almost like you try it out and see what happens. It might work for you, it might not.
All right, double cleansing. So this is like, what's the most common double cleanse that people ask you about if they should be doing?
It's usually, should I do an oil-based cleanser followed by a water-based cleanser? And I think this also has its place. I give it 7, 8-ish. If you're someone who's like taking on a bunch of makeup or sunscreen, using an oil-based cleanser first helps get rid of those oil-based products. And then using a water-based cleanser thereafter helps get rid of the water-based products, right? Oil or fats are hydrophobic. And so if you're putting a water-based cleanser on lipid-based products, you're not going to get them off your skin as well as if you were to use an oil-based cleanser.
That makes so much sense. I never put that together. So hydrophobic means it's like scared of water. It's not going to mix like oil and water. Yeah, that's helpful. Okay, silk pillowcases.
I love them. 10.
Oh, okay. I was not
Yeah.
expecting that. Why is that?
Silk is not going to absorb as much oil over time, so your risk of outbreak is a little bit lower. And then we'll talk about it, but friction is often a common cause or trigger of acne, and there's less friction associated with a silk pillowcase than with like a cotton pillowcase.
How often are you washing your silk pillowcase?
I recommend once a week if possible.
Okay.
Washing a silk pillowcase is not an easy chore. I mean,
No,
you
it's
have to let it like air dry and all this stuff. So
it's very delicate.
Yeah. But so is our skin. So, it's like we got to do the things we need to do. Okay, how about mighty patches or other pimple patches?
Yeah, I give those like a 5. The place in which I really like it is for the patient that's a picker, because if you slap it on there, it's a physical barrier. You're less likely to touch, less likely to make your acne worse and risk scarring. Is it actually going to help improve the true outbreak itself? Hard to say. There's no harm in utilizing them, but I can't sit here and promise to a patient that it's going to actually help the outbreak.
Makes sense. And it's also retroactive, the right word? Like it's not proactive at all, obviously.
Yeah.
It's just putting it on after the breakout has happened. That's not getting at like the root cause at all.
Totally. Yeah, it's not going to prevent anything.
Do you know if it matters which brand of pimple patch you're using?
No brand like specifically matters, but each brand has their own like straight hydrocolloid patches versus like some have salicylic acid impregnated within them or something like that. So if you're sensitive, you have to be careful with things like that. It's kind of on an individualistic basis as well.
Very helpful. Thank you.
Yeah, especially because do you buy them, Eden? I know Ella buys them, and they're kind of expensive.
They're expensive, and she just found out that her is it your HSA health savings account?
Yeah,
it falls into that, which I think is amazing, and it should. But yeah, they are expensive. But I agree. I think even if it's not doing anything, I work with a lot of kids, and they're like touching my face, getting close to my face, and I'm like, don't touch my acne. It's getting worse. So I don't feel confident enough to wear a pimple patch, but I wonder if maybe I should, like out and about, because I feel like I'll be close to cleansing or kind of clearing up my skin. And then something like that will happen and I can just like feel it triggering my skin.
They're just like touching all
yes,
over.
I'm like, oh, yeah. Or like my dog's licking my face. I'm like,
oh no.
Yeah.
Clear Stem products. Do you know that brand? And I'm not trying, like, I think that they seem great. I'm just curious from your perspective, someone who works in dermatology, like, is their marketing accurate in your opinion from what you know about the science?
Yeah, so Clearstem has a bunch of different products. They have topical products like mandelic acid, they have cleansers, moisturizers, and then they have some pretty specific acne supplements. Online, I see a lot about the supplements, and I'll be honest with you, there's not a lot of concrete data on the efficacy of those products. Most of them have a little bit of vitamin A in it, some vitamin B5, which can be helpful for acne. But again, we don't have any true clinical data on the efficacy of those. I know a few people who utilize their mandelic acid and really like it, but for me personally, I just haven't seen enough concrete data to be able to recommend them to my patients.
Makes sense. What about dermaplaning?
In terms of how it relates to acne, I'd give it a 5. If you are technically scraping off all those hair follicles, you risk physically clogging the pore and then can therefore make your acne worse. So oftentimes I'll tell my acne prone patients avoid dermaplaning if possible because there is a risk of making it worse.
Okay, thank you. That was so helpful.
Yeah.
We could end the podcast here. I mean, I just learned
I know.
so much
I know.
information. And this is like acne. It's so important to talk about because it affects a lot of people and it really can mess with your self-esteem and your confidence. And I feel like for me, I don't want to wear a lot of makeup at work, but if I have a lot of acne, it feels almost like unprofessional or I don't look prepared or something for work. So I think it's important to understand and again, like give people tools to be able to help themselves to feel more confident and feel more like in their body, in their skin. But I'd love to hear more about like what is acne? Like talking to someone who has no idea what the term even means. I'd love for you to define it and share more about that.
Yeah, so acne is technically a follicular or like a hair follicle disorder. It can occur anywhere on the body that we have hair follicles, but most commonly we can see it on face, chest, back, sometimes buttocks.
Buttocks.
Yeah, buttocks.
Buttocks.
It's kind of like a 4-step process that I think about in terms of like how do we get acne. So the like buzzword that's thrown around really commonly in dermatology and online is pore. But like what actually is a pore? Essentially, we have all these teeny little hair follicles within our skin. They start off with like a big bulb and then a tiny little hair shaft will extend out from that within the skin itself. And then it has a tiny little opening where the hair will reach the actual surface of the skin. And that opening where the hair reaches the surface of the skin is considered a pore. And so the first step that happens in the development of acne is we have some kind of blockage of this opening or blockage of the pore. And that can be physical or just kind of like an innate thing. So that can be makeup or that can just be our skin cells have proliferated or turned over so quickly that they're now then clogging that pore. When we then clog that pore, the natural oils that are produced by that hair follicle don't have anywhere to escape out onto the surface of the skin. So we essentially end up with a buildup or like a bubbling of this sebum or skin oil within the skin itself. And that acts as the perfect environment for acne bacteria or C. acnes to kind of flourish. So we have this like lipid-rich sebum or oil bubble that the acne is then feeding on and then doubling and proliferating in size, which then causes inflammation in the skin. And bam, there you go. You have an acne lesion.
Oh, sounds so painful. And it is.
Yeah.
So every single pore has a little hair that goes with it. Oh my goodness. Okay.
All your little peach fuzz.
Yeah. Okay. That's helpful. I feel like there are a lot of triggers that I hear about on social media or friends, like triggers that could cause acne or make acne worse, diet, sleep, workout routine, obviously all of the products you're putting on your skin. So I think it'd be helpful to go through each one and give a little bit more information about it. So I think diet might be a good place to start.
Yeah, totally. So when I think of these kind of like diet, exercise, sleep, etc., and their impact on acne, I'm always going back to one of the 4 steps that leads us to an acne outbreak. And so these things are going to impact one or more of those 4 steps. So the first one that we think about, diet, right? We have this thing called a glycemic index. And Cruzy, you probably could speak better to the glycemic index than I can.
No. Go
But
ahead.
essentially, it's like this spectrum that they utilize to kind of like rank foods based on how quickly are they going to spike your insulin levels or your blood glucose levels. And it goes from 0 to 100. And anything like 70 or higher is considered a high glycemic index food.
Okay.
So those are going to be things like white bread, pastas, sodas, candies, ice creams, some of those like processed sugary foods, but they don't have to just be processed or like seen as unhealthy, right? Potatoes, sweet potatoes, watermelon can all do that as well.
Mm.
And essentially what's happening is that when we digest these foods, our pancreas will produce insulin in response to the blood glucose levels going up, which just helps us regulate the blood glucose throughout the body. And when the insulin levels go up, we oftentimes see a spike in sebum or oil production. And so if we have increased oil, that's essentially increased food for our acne bacteria, and that can lead to a breakout.
Wow.
That's fascinating.
Yeah, it's
All of
pretty
the
wild.
foods, all the foods I love. I'm like donut, bread,
Yeah,
potatoes.
all the yummy things. They're
Yeah.
so bad for acne.
Wow, that's crazy. Okay.
Yeah.
Talk about milk in that category. How do you talk to patients about milk and its relation to acne?
Yeah, so the whey protein within milk can spike insulin levels as well. But there was a recent study that came out that's actually really fascinating. They've seen that nut milks, oat milks, almond milks, that kind of thing actually spike your blood glucose level higher. And so those have an even higher implication on acne than just straight whole milk.
Wonderful. Okay, what if it's straight up like oats and water versus the like gums and sugars and other things that are in some oat milks? Like, is it the oat itself or the
Eden,
other
you're a
additives?
scientist already.
Yeah,
You're
that's
already
such a great
finding
question.
confounding variables
Look,
and
this is
getting
just
them out of there.
this is just for me. Like, I'm taking notes because I have oat milk in the fridge and I need to know if I need to pour it out, you know?
I don't think you'll have to pour it out.
Okay.
The oats themselves do have a decently high glycemic index, so my understanding it is the true oats. Now, obviously, the xanthan and everything else that's added in there is not helpful, but if you were to take true oats in water, I'd anticipate a similar effect.
Oh my goodness. Okay, because I've heard people say our bodies like don't know how to appropriately like intake oats or like not to be eating a lot of oats, but in my mind oats are like this healthy granola girl thing. But it all makes sense. It all goes together.
I think Granola Girl is a major marketing scam because I'm
Totally.
like pretty anti oats because you're right, Shannon, like they spike your glucose high and then your insulin spikes in order to get that glucose into the cells. But over time, having high insulin levels is no bueno. And that's like the start of diabetes
Absolutely.
and metabolic dysfunction. So yeah, I think oats has been a big marketing scam. I mean, I love like eating granola. You know, sometimes it's good to like sprinkle on top of stuff, but not as like your base for a meal, and especially not for your first meal of the day on an empty stomach.
I know
Yeah.
we're not in nutrition, but do y'all know a substitute for oats? Are oats giving you anything that we need?
Fiber.
Okay,
Good
so like chia
fiber.
seeds.
Yeah.
Again, this is for myself. I'm about to make some protein balls, so I'll use chia seeds instead of oats.
I mean, and I eat them too. It's just, I think you can't think of oats as like some superfood that's a lovely base for your breakfast.
Yeah, and I think they've
Especially.
been marketed that way, so that's helpful.
Totally.
Yeah.
Also, Chrissy, totally unrelated, and I don't know what your thoughts are on this, but
Yeah.
like if you were to take an actual oat, that's like in its true fiber form.
True.
Versus
Very
an
different.
oat and oat milk has already been degraded down to a certain degree. And so I think the glycemic index or the glucose impact is lower for a true whole oat because your body has to break it down first and then absorb the glucose.
Yeah. Like a steel cut oat is much better on the glucose spike versus like instant oats.
Yeah.
Why are you
Yeah.
laughing?
Because I only buy rolled oats, so great. You guys are so smart.
It's fascinating. The CGMs, the continuous glucose monitors, a lot of people that wear them say oats are like the biggest culprit of their glucose going through the roof. Because I think a lot of times people eat it first thing in the morning, either
Mm.
on an empty stomach or with black coffee or something, and then they put fruit. They put like banana.
Yeah.
They put like peanut butter, which is mostly a carb, and then they put like honey on it, and you're just like up, 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 up. So
My gosh.
not great. Shannon, this is kind of related. It's not food, but other things that people would eat, how they relate to acne. Talk about some supplements. Like what supplements could people be taking that could be causing acne?
The biggest one I see is B12. B12 has boomed. It's like this huge trend. It's in so many energy drinks that people don't think about, like not to put them on blast, but Celsius has so much B12 in it. And
Yeah.
we've seen that vitamin B12 is going to increase the bacterial activity on the skin and therefore huge acne outbreak thereafter. Yeah, the other like most common one I think about and the mechanism behind the way in which it triggers your acne is still poorly understood. So I can't really speak to that as much, but we've been seeing an increase in acne outbreaks associated with biotin supplementation, which is also really big right now. So something to consider.
Okay, let's talk about how stress can impact your skin or your acne.
When I think about stress in the body, we have something called the HPA axis, or kind of like the stress response in the way in which it is communicated throughout the body. So we undergo some kind of significant stressor. So the hypothalamus within the brain sends out these communicating signals or messengers called hormones that go down to the pituitary, and then the adrenal glands will send out their version of these hormonal messengers, of which one is testosterone or an androgenic hormone. And so if we have this increase in testosterone, essentially from some kind of stressor, testosterone can then act on our sebum or our oil glands and cause an increase in oil production. So in a roundabout way, stress is going to increase your oil production, which then remember is that big bubble for the bacteria to feed off of and then causes you to have acne.
Nobody stress about their skin.
Yeah, don't stress.
It's all
That's
going to
like
be okay.
the hardest thing to tell patients. Don't be stressed.
Yes. Okay. I want to summarize what you just said because I think it's really cool and definitely nerdy but fun. So the HPA axis is the hypothalamic pituitary adrenal axis. It's such a mouthful, but it just means how the brain is communicating to the other organs in the body through hormones. So like she said, the hypothalamus is kind of like the mastermind, and that sends out signals to the pituitary gland, which sits under it, and then that sends out signals to the adrenal glands, which are tiny little mounds that sit on top of the kidneys, your little beans on either side of your flanks. So they send out DHEA, right? And then
DHEAs,
that.
yep. So DHEAs are essentially precursors to testosterone. So those will act on like the ovaries, and then the ovaries will produce testosterone.
Makes sense.
Okay, what about sleep?
So sleep in acne is still poorly researched at this point. There are theories or hypotheses in place as to how it's impacting it. And the biggest one is that when you are in a sleep deprived state, your body signals or feels that as stress. And so you will go through that entire stress axis that we just talked about. When you are also in a sleep deprived state, we think that that increases your body's inflammatory response. And so you can have some inflammation of the skin, which can also lead to acne. But this is an area where we really need to learn more and study more on it.
If anyone's watching, I'm drinking out of my Owala. And I don't know if y'all heard this, like it's named Owala because it looks like a koala when you drink out of it.
Do it again. Do it again.
Wait, hold on. I gotta put my hand.
Oh,
She's so cute. But every time I drink it, I'm like trying not to, laugh at that.
Feel like a little koala.
A little koala, yeah. Okay, that was helpful. Shannon, let's talk about hydration.
hydration, similarly to sleep, still needs to be studied a lot more in terms of how it's impacting our acne. But again, the big hypothesis here is that if we're dehydrated and our skin is truly dry, it recognizes the need for some kind of hydration. And so it will overcompensate and produce more oil in response to the dryness, which can then kind of exacerbate or precipitate the acne response.
Wow, it is all connected. It's
It really
crazy.
is.
Okay, let's just keep going. How about exercise?
Yeah, so when I think about exercise, I think about ways in which it can improve acne and ways in which it can also exacerbate or worsen acne. So if we were to look at how does it improve acne, we see moderate exercise lowering the overall stress response. So if you're lower stress, you have lower testosterone production, therefore lower acne. It also increases your blood circulation, so you have better barrier repair of your skin layer and better skin layer function as well. It can be anti-inflammatory, which will help reduce your acne and then help kind of balance your insulin or your blood glucose levels so that we have less acne as well. Then, like, how can it worsen acne? There are a lot of ways in which it can do this. Sweat itself can manually block that pore. So remember, that's the first step that happens. If the sweat blocks that pore, there's nowhere for the sebum or the oil to go. So therefore you have acne. But friction is a huge thing that we see as well, whether it's patients rubbing themselves with a towel as they're working out, they're wearing hats, helmets, things like that will cause inflammation to the actual hair follicle, which can stimulate acne as well. And then if you're doing vigorous exercise without appropriate rest, hydration, protein, etc., your body can see that as a stressor as well. And so it can activate the stress response.
So if you're able, would you recommend washing your face like every time you work out, soon after you work out?
Ideally. Now, does that always mean you're washing with the cleanser? That's dependent upon kind of your skin type. But in some capacity, we should be cleansing our face after exercise. And then if you're prone to sweating and you have a lot of drippage going on, instead of rubbing your face with the towel, I would recommend you like blot your face. You're going to get less friction by doing that.
Dab, dab.
Dab,
Okay,
dab.
cool.
Yeah.
And then weight kind of falls into this category, but does weight affect your acne?
Yeah, weight affects your acne very similarly to kind of diet, like we discussed a little bit earlier. Oftentimes we'll see an increased weight and a decreased insulin sensitivity. So you'll have more blood glucose circulating throughout the body, and therefore your acne is more likely to flare.
Gosh, I really am like, I'm going to listen to this episode several times to get it all down. It's so helpful. Does genetics play a part and also like hormones? How does that work?
Yeah, so genetics plays a huge component in acne. You are correct in that regard. If both of your parents have had acne of some degree, then the child of those two parents has about an 80% chance that they're going to develop acne at some point in their lifetime. So a lot of it is genetically driven, regardless of the things that you're putting on your skin or the hygiene that you're utilizing. Some people are just at a disadvantage, and you have about an 80% chance that you'll develop it. Hormones we kind of touched on a little bit already, but hormones do play a huge part in acne. And most of that is due to the testosterone surge that can occur after both just the natural menstrual cycle or external stressors or responses that can have on the skin. I also think about like hormonal birth controls and IUDs playing a component in that. I think if we were to bring Megan on the podcast, she may have a differing opinion. It's kind of like the battle between OB-GYN and derm. But from my experience and the data that I have read, hormonal IUDs, things like Kylena, Skylena, Mirena, all drive female hormonal acne. And when I think about female hormonal acne, oftentimes that's going to be distributed along the jawline and lower cheeks, chin, and it can even extend down onto the neck. Oftentimes that's the really painful cystic acne, those like under the skin bumps that never really come to a head. And all of that is seemingly driven by testosterone, which my understanding is the Mirena IUD, progesterone only will increase levels of testosterone.
Yeah, and that was your experience, Eden, right?
I do feel like it's gotten worse. It's kind of hard to differentiate like what has caused it. And I think we're going to get into this later, but like I didn't have a lot of acne as a teenager, but I feel like mid-20s, like early mid-20s, I started to have a lot more acne, and like I don't know if it's cystic or hormonal. I don't know the specific type, but it feels very hormonal. And it's like, wait, why am I thought I was supposed to have clear skin now, or I thought I missed the acne stage. So it can feel really like frustrating and confusing.
Absolutely. That's like a huge thing for women in their mid to late 20s. I had clear skin for forever. Like, why am I all of a sudden now getting these like hormonal acne outbreaks? And there are a lot of reasons why that can occur. You think about like as you're going through puberty as a teenager, your hormones are all over the place. Your body is just trying to level out its normal natural cycle. And then once your menses becomes regular or pretty regular thereafter, you're still having hormonal fluctuations within that. right? Like things like, I don't know, I got sick this month, so my cycle is a week later, etc., can impact when the hormones are released, and then to a degree, like the amount of hormone that's released. And so oftentimes you can see hormonal acne flares during your 20s because your cycle is still not 100% perfect. And then, mid 20s, late 20s, we oftentimes will introduce birth control, whether that's oral birth control or hormonal IUDs, which can play a factor there as well. And one thing I forgot to mention, the reason why we oftentimes will see hormonal acne outbreaks kind of jaw, chin area is because those areas have a higher concentration of androgenic or testosterone receptors. And so if testosterone is the true triggering factor for acne, it is binding most commonly here in this area because there's more opportunity for it to bind and therefore cause acne.
That's
What are
fascinating.
the other regions of your face? Like, are those correlated with specific types of acne or causes of acne?
Good question. So over like oil production, blocked pores is a type of acne called a comedonal acne bump. And that is either like an open comedonal acne, blackhead, or a closed comedonal acne bump. Oftentimes those will occur kind of like in the T-zone where we have a lot of oil production. And then bacterial acne, those true pustules where you can pop and the pus comes out of them. Oftentimes we'll see hairline from sweating, sometimes even cheeks or jawline. But mostly I see it on the forehead.
Pustule, has to be the worst word in the world. That's terrible. Oh,
Honestly, the harder thing to say is purulent, which is
Purulent.
pus-like. You can't say pussy, like that's not a medical term. The
it
term
also
is
sounds like
purulent.
almost really weird. Like,
Yeah.
yeah,
Bad.
don't mess
Yeah.
up your vowels. Ooh.
Yeah.
No, yeah. And so it's purulent, and that one's even harder.
All right, let's talk about gut microbiome. That is super hot right now, at least on my social media feeds and in conversations with my friends. How might that impact acne?
Yeah, I'm super optimistic and looking forward to further studies coming out on the gut microbiome and the impact on acne. Right now, the data is limited, but I think what we're seeing in a lot of areas of medicine is that the gut microbiome has a huge impact on our overall health, a lot more than we thought maybe even 5 to 8 years ago. So while the data is limited, what we see right now is that those with acne typically have a decreased diversity of bacteria living within their gut. And that's kind of all the data shows presently. But what that tells me is that there are future studies that need to investigate what if we were to replenish with appropriate gut bacteria, et cetera, and how will that impact the acne?
I feel like there's got to be more to come there. I think you're right.
Totally. Yeah, and I'm excited for that. I think one of the hardest things about acne is that it is multifactorial. It's a lot of little different things working together at one time. And so to be able to parse out each individual variable and sit there and say, this is exactly what's causing your acne is nearly impossible.
I think that's why it's so frustrating and exhausting. Like I don't know. I feel like I spend so much energy thinking like, okay, maybe this is why, or maybe this will help. And a lot of money too. Like skincare is so expensive. Or I'm getting the cheap one from my local grocery store and I'm like, is this even doing anything? So yeah, I think this is helpful. And like you said, so individualized. Like it has to be personalized to your skin, your hormones, your season of life. Which complicates it. But that's why we have smart people like you who have done the work to help us specifically.
This is just like a complete aside. And I'm like so thankful, Chrissy and Eden, for this opportunity to talk about acne because like we just talked about 6 different like environmental or internal factors that can impact acne. And I think one of the huge limitations with dermatology is that we're given a very finite amount of time to talk with you about your acne. And oftentimes, like I'm fortunate enough to be able to provide 15-minute appointments, which is considered long in dermatology. And oftentimes that 15-minute appointment is entirely eaten up by talking about the various prescription management ways in which we can treat your acne. And oftentimes things like the gut microbiome or diet are left off. And so to be able to sit down and have a further conversation about that, I think is really beneficial for patients and something that we're really lacking in our current medical system.
Can we talk about like specific medical conditions that might make you more likely to experience acne?
Yeah. So when I think about medical, like pharmaceuticals or prescriptions that can cause acne, steroids is one of the big ones. So that's prednisone, that is utilized to reduce inflammation in the body. We already talked about birth control being something that can cause acne, hormonal replacement therapy or exogenous testosterone. So women getting testosterone pellets, B12 supplementation, like we talked about. And then there's kind of like a various miscellaneous, less common epileptic or seizure medications. There are certain cancer medications and then mood stabilizer medications like lithium that can do it. When I think about conditions, that's a great question. I see a lot of acne in like PCOS patients or just like obese patients with diabetes, but those are usually a smaller subset of the patient population in which I work with.
We've kind of touched on this, but I think it's helpful to have like some practical takeaways or like application of this information. So thinking about potential lifestyle changes that people can make for overall like skin complexion and reduction of acne.
Yeah, so you're going to want to make sure that any product that you're putting on your face, if you're acne prone, is non-comedogenic, which just means non-pore clogging. And that goes from everything from your cleansers, lotions, sunscreens to your makeup products that you're utilizing. All should not clog pores or make your acne worse. If you are wearing heavy makeup, consider double cleansing and definitely make sure that you're washing your makeup before you go to bed. Otherwise, that's just a layer that's sitting there waiting to clog your pores and cause an acne outbreak. Exercise, we kind of talked about cleansing your face shortly thereafter if possible. Otherwise, things like hypochlorous acid spray or even just like a gentle cleansing wipe can be helpful. If you're wearing hats, I see this a lot. Hats will create a little residue of sweat. And over time, that's a breeding ground for bacteria. So making sure that you're washing your hats frequently can be beneficial. A fun tip there is oftentimes patients will put them on the top rack of the dishwasher, and that can help keep their shape, but also cleanse them or sterilize them. And
I
then
need that, y'all. My hats are gross. They
they're
have like a
gross.
line of,
Yeah.
they have like a makeup line right here.
Ew, no.
Yeah. And then they'll start to get that little sweat line. Yeah.
Yeah. Ew,
Yeah.
yeah.
And then changing out of your tight exercise clothing quickly after exercise is also super helpful. Hydration, like we talked about, sleep, stress management as best as you can. And then avoidance of picking at your acne will help reduce kind of hyperpigmentation or little scarring marks that you can get after the acne bump has resolved. And then hair care is a big one that I don't think a lot of people think about. So keeping your hair clean, especially if you're someone who has bangs, that kind of oil production from the hair is going to rub on your skin and then increase your risk for acne outbreak. Avoidance of oily hair products, especially at the root of the hair or anywhere the hair is touching the face. And then I see this a lot with patients who get acne on the trunk or the back and the chest. Oftentimes patients will cleanse their body and then wash out their conditioner because the conditioner sits for a certain amount of time. But conditioner is super lipid or oil fat based, and that can clog your pores. So I recommend that you actually rinse your conditioner off first and then cleanse your chest and back to help prevent acne outbreaks there.
That is so helpful. And I do that. I'm like, let me leave my conditioner in and I'll wash my body and then I'll take my conditioner out. Interesting.
Yeah.
Yeah. Avoidance of a loofah, if you're prone to getting body acne, is a big thing. Loofahs harbor bacteria. That's so disgusting. And they're also an irritant to the skin, so that can make your acne worse. Pillowcases, like we mentioned, love the silk. Definitely wash it once a week if possible. And then physical exfoliation or those cleansers with those beads in them have been super popular, but those beads will cause undue irritation to the skin, which can then further perpetuate your acne. So if we're going to do any kind of exfoliation to try and get off any excess dead skin cell layers, we should be doing that from a chemical perspective and not a physical exfoliant perspective.
I got it's like a rhubarb something exfoliant, like again, natural something.
Rhubarb.
I don't know, Cruzy. Mom uses it. So how do you know if it's a chemical exfoliant?
So chemical exfoliants are going to be things like mandelic acid, glycolic acid, salicylic acid, or like a retinoid, tretinoin, adapalene, that kind of thing. A true physical exfoliant is going to be anything that has a gritty or sand-like sensation that you rub on the skin to try and slough off that extra layer. The mechanical exfoliation is harder to control, so it's all pressure-based, and that can cause undue irritation.
Okay. Also for the Komodo, how do you say?
Yeah.
Komodo.
Yeah.
Komodo
Non-comedogenic.
dragon.
Yeah.
Non-Komodo dragon skincare. Wait, say it again.
And the non-comedogenic.
Yes. How can we ensure that we're getting that? Like, will it say,
It
or are there
should.
like products we should look to avoid?
It should say non-comedogenic on the box.
Okay. Wonderful.
And beef tallow is not one of those, unfortunately.
Well, so what's interesting is there are some beef tallows out on the market that are marketed as non-comedogenic, but from a physiologic standpoint, I just can't comprehend how that's possible.
Yeah. Yeah. It's so thick.
See, this is what stresses me out. Like, you hear both sides, but it's helpful to hear like the science behind it, like what's actually happening in your body or what is the reason behind some of this stuff. And I also have heard if you are using an exfoliant, almost using it preventatively or proactive, like we talked about. So if you don't have a lot of acne, it can be helpful. But then I've also heard if you have existing acne or exposed acne or like those sores or abrasions, not to use an exfoliant because it could spread the acne. Is that true?
It's not going to spread the acne. I haven't seen any way in which it's going to like physically move the acne elsewhere or the bacteria, but it is causing inflammation to the acne, which then signals an immune response. And so you're going to get an exacerbation of the acne just from the physical irritation. And then to the other point, all acne products or treatments ideally are working in a preventative manner instead of a retroactive manner. And so anything that you're putting on your skin now is theoretically treating acne 3 months down the line. It can take 3 months for topical acne medications to actually start working. And so, yeah, I wouldn't put any kind of physical exfoliant on a true acne outbreak though. That worries me a little bit.
Okay, good to know. And 3 months is a long time to be
It's a
feeling
long
like
time.
not your best and not beautiful. So stick with it. Give yourself 3 months. There might be light at the end of the tunnel. I'm talking to myself. Let's move on. What are commonly prescribed medications or ones that you might prescribe to treat acne?
Yeah, so when I think about acne medications, I'm dividing them up into little categories. So first I think about our topical medications. Those are the most commonly utilized medications with the lowest possible side effect profile. So topically, we have the antibacterial or antimicrobial options. Those are killing off that C. acne bacteria that's causing our acne. And most commonly, that's going to be clindamycin or benzoyl peroxide. Benzoyl peroxide is available over the counter in various different strengths. And then clindamycin is a true prescription that a dermatologist or dermatology PA would have to prescribe for you. But it's essentially making sure that there's no active C. acne on the skin so that then we can't have acne outbreaks. Most commonly, this will help with the pustule-like bumps that we're getting. Then the next kind of category of topical acne medication that I think about is anti-inflammatory. So reducing the immune response once an acne bump has formed. And those are going to be dapsone, which is a prescription strength medication, or azelaic acid. And azelaic acid is found both over the counter and in prescription strength form. So that one is available over the counter. Then I think about something called a keratolytic, and that's just a really fancy way of saying unclogging the pore, turning your skin cells over quicker. And most commonly, that's either going to be a sulfur-based cleanser. Most of the time, that's prescription strength, but there are a few over-the-counter options, or salicylic acid, which is a super common over-the-counter acne medication a lot of people reach for. Salicylic acid comes in both like a cleanser version as well as topical gel or lotion that you can put on the skin. And then the last category of topical acne medications that I think about are retinoids. Retinoids are a vitamin A derivative, so a type of vitamin A that essentially turns your skin cells over quicker and unclogs your pores. Retinoids are oftentimes tretinoin, adapalene, or retin-A. Those are all the prescription strength versions, and they're helping to treat the clogged pore acne, so the comedonal acne that we talked about, and they can also be really beneficial in the cystic acne world.
Is there a difference between tretinoin and retinol?
So tretinoin is a retinoid, and a retinol over the counter is a lighter, less potent version. Essentially, there are different like active ingredients and precursors that go into all of that, but it's essentially like a lighter, less potent version.
Cool. I feel like retinol or retinoids have become more commonly used, but I don't feel like people talk about the risks or things to consider when using a retinoid. Can you talk a little bit more about that?
Yeah, so the biggest thing I think about is sun sensitivity. So it makes you more likely to burn, and therefore it makes sunscreen super, super important. It also can cause excess sensitivity when you're doing anything like waxing, chemical peels, lasers, microneedling. So stopping at least a week, if not 2 weeks prior to some of those treatments is absolutely necessary. If you were to go and get your eyebrows waxed, let's say, and not take a hiatus from your tretinoin, that wax is going to rip off that top layer of skin. So it's definitely something that you want to avoid there. And then most retinoids are going to be applied at night because they can be deactivated by sunlight or degraded by sunlight. There's one caveat to that, and that's a prescription strength medication called adapalene, or it's over-the-counter Differin. But nighttime application is a huge thing there. And then any kind of retinoid is going to cause increased skin cell turnover. So you're going to get dryness, irritation. Oftentimes we'll say do it every third night for a couple weeks, then every other night for a couple weeks, and kind of slowly titrate or work your way up to nightly if your skin can tolerate it.
So I use retinol and I feel like I know I need to be using sunscreen, but I'm hesitant because I feel like sunscreen would make my acne worse. Any recommendations there?
Yeah, so there are a few different types of sunscreen out there that are great for acne prone skin. It's just all about finding the one that you feel like is best for you. What I say for super hesitant patients is find a zinc based sunscreen. Zinc has antimicrobial properties. It's not going to clog your pores. And so you'll be kind of combating a bit of acne while also utilizing your sunscreen at the same time. So if you're able to find a zinc based sunscreen that you're willing to put on, that's probably the best option.
Wow, that is so good to know. I assumed zinc was like the most pore clogging because it's
No,
like
yeah.
so thick and heavy. That's really cool. Okay.
One question about the retinoids. Why can't those be used during pregnancy and breastfeeding?
Mm-hmm. So they're not recommended during pregnancy because they're considered teratogenic. They can cause craniofacial, cardiac, and even central nervous system defects to the fetus. Breastfeeding is a really interesting aspect in terms of a lot of dermatologic medications. And essentially the reason why we don't recommend it during breastfeeding is because we don't know what the effects are. There haven't been women who are willing to participate in clinical trials with that, which I totally understand. And so we don't know what the effects are. So better safe than sorry, just don't do it. Usually we say once you've conceived, stop the medication.
Okay.
There's no data that says that you can't utilize prior to conception, but every patient's different. I have a lot of patients that are like, I'm not comfortable with that. The second I know I'm trying to conceive, I'm going to stop.
Okay.
And what are alternatives when you are pregnant that you can use that have a similar effective retinoids?
I always butcher the name of this, but how do you say it? Bukkake.
Oh, I have no idea. I see that word and I'm always like, the natural retinoid alternative,
How do you spell it?
Bocaccia. I don't
It's
know.
like BUKIOHOL or something like that.
Yeah, people will know what we're talking about if you've seen it. Yeah.
That is supposedly safe during pregnancy. It's a plant-based product that has similar effects of a retinol. The only other two prescription strength medications that are safe during pregnancy and breastfeeding are clindamycin and azelaic acid. So acne in pregnancy is a really challenging thing to treat. There are not a lot of options out there.
So those were all topical remedies or medications. What about oral?
Yep. So then once we go into the oral category, I kind of divide them up into three parts. First part I think about are oral antibiotics. And most commonly that's going to be minocycline or doxycycline. There is a newer version of those out called Sacera. And the idea behind Sacera is that it's supposed to have less disruption on the gut microbiome, but it is not generic presently and can be super expensive to get for patients, and a lot of insurances don't cover it. But the idea behind the oral antibiotics is that they're eradicating the C. acnes on the skin. And then these antibiotics also have an anti-inflammatory component or property to them. So you're reducing inflammation in the skin as well. The troublesome or challenging thing with an oral antibiotic is that it's not safe to use long term. So it can be really beneficial for up to 3 months. But then if your acne comes back thereafter, we have to look at alternate options because it's just not something that you can do long term. So then the next category I think about are hormonal components. So you have oral birth control pills, and then you have a medication called spironolactone. which is super commonly used for female hormonal acne. It was originally invented as a high blood pressure medication, and then we found out low doses, it will help reduce circulating testosterone in the body so that it can't bind to those oil glands and cause acne. Super well tolerated, but it's not a medication that every patient is willing to go on. And then the last category that I think of is isotretinoin or Accutane, which is a vitamin A analog, and it's the closest thing that we have to a cure for acne. About 85% of patients that go on Accutane never really worry about severe acne outbreaks thereafter, but 15% do still struggle with acne. And there's no data on this, but anecdotally from what I've seen in clinic is that 15% that fail Accutane typically are my female hormonal acne patients.
Mm.
And it
And
makes sense if you think about it. It's
Mhm.
not, the vitamin A isn't working on the hormonal cascade in any capacity. What the vitamin A is doing is it's working to permanently shrink down your oil glands so you produce less oil and therefore have less acne. And so if I'm not targeting any kind of hormonal cascade, then your acne is likely to come back.
Okay, let's talk about alternative approaches to treat acne.
Yeah, so we kind of talked about how medical and cosmetic dermatology oftentimes have an overlap. And again, this is an individualistic thing for the patient. Not every patient that comes and sees me wants to treat with pharmaceuticals. Some want to do alternate options. And what does that look like for patients? The first I think about is red light, blue light masks, which are huge right now. They can be beneficial in acne. What we're seeing is that the red light, typically with a wavelength of around 633 nanometers, is going to reduce inflammation in the skin. And then blue light around 415 nanometers is going to target or kill off that bacteria that causes acne. On average, they're seeing patients do this 3 to 5 times a week, and it can help reduce your acne. So it's an option. The downfall with those guys is that they are pretty costly. They can be kind of expensive. Other things that sometimes help with patients' acne are chemical peels. Those can have things like salicylic acid in it, TCA acid, kind of like chemical exfoliants like we talked about that are just going to kind of unclog those pores and over time help patients with acne. Those are typically done in a series of 3 spaced out about a month apart. And the downfall with these guys is that it's not covered by insurance. So it's an out-of-pocket cost to the patient most times. The other kind of like acne cosmetic thing I think about are acne facials. Super helpful for a patient that has a bunch of those comedonal or clogged pore acne bumps. Those are usually those like textured skin or flesh colored bumps that patients will get on their foreheads. They can steam the face and then go in and poke each individual acne bump and squeeze out the contents to get rid of it.
sounds
Sounds
lovely.
painful.
Yeah, painful, but can be effective.
I've heard a lot of things. I've heard sometimes getting a facial isn't good for acne. So is it important to specify like an acne facial?
Mm-hmm. Acne facial
Okay.
with extractions would be
Okay.
when they're poking and squeezing all of the stuff out. You're right. Facials have a bunch of different components, the things that they're slathering on your face. And so for some acne prone patients, that's not going to be a good option. You'll want to talk with the esthetician and make sure that they know that you have acne prone skin.
What about for those of us who have like managed our acne, but we have scarring from acne? Is there anything you can do about scars?
Yeah, I get this question a lot in clinic. Oftentimes patients with current acne will come to me and be like, hey, I hate this acne. I also hate the scarring. What can we do about both? Let's address both today. And my kind of messaging towards that is that we really do need to treat the acne first before we go addressing ways in which we can treat the scarring. Because if I'm treating your scarring and you're still getting new acne bumps, you're going to then get new scars. And so we're just going to be chasing our tail. So definitely make sure that your acne is well controlled and managed prior to aggressively going after acne scars. Commonly, I will see patients with something called post-inflammatory or after inflammation, hyperpigmentation or brown spots, and redness. They'll be like, look at all these scars I have. And thankfully, those are not permanent scars. Those are just discoloration, whether it's red or brown in the skin that comes from the inflammation that the acne bump caused. Over time, if you were to do absolutely nothing to those, they should fade all on their own, but that can take 6 to 9 months to happen. It's a long time for someone to wait. So what are other things that can be done to help kind of speed that process up? When I'm thinking about reds, the number one thing that's going to help with that is going to be azelaic acid. It can help kind of reduce down the redness and the appearance of the red. And then for the hyperpigmentation or the brown spots, oftentimes a retinoid of some sort or a niacinamide or a bleaching agent like a hydroquinone or tranexamic acid topically can all help reduce that. It's just dependent upon how severe is it and how aggressive does the patient want to be. Then you start to get into the deeper scarring that is more permanent. Those would be like the ice pick scars, the box scars that you see. Those involve deeper layers of the skin and therefore can be a lot more challenging to treat. You'd oftentimes be looking at some kind of laser treatment, whether that's a CO2 non-ablative or ablative. Sometimes microneedling if it's superficial, but some kind of more aggressive treatment to kind of slough off that top layer of skin and allow the skin to regrow without those pock marks.
Whoa, sounds intense.
Painful and expensive, honestly.
Yeah. Also, you mentioned it could take 6 to 9 months for those scars to clear. Does sunscreen help that process? Like, is it important to wear sunscreen over scars, I'm assuming?
100% wear your sunscreen on top of the scars. Any additional sun exposure that those dark marks or red marks get is just going to have them stick around a little bit longer. And so proper sun protection, sunscreen, hats, staying in the shade is all super important for that.
Okay. I have a specific question. Let's bring back our word pustule. What is it?
Pustule.
Pustule. And you described those as the like pimples or acne that you can like pop and pus comes out, hence the name. Are there times where we really should be popping pimples or getting the pus out, or should we like never touch them, even if it's like really there, really ready to go?
Ideally, you would never touch them. The idea behind it is that when you're popping your pimple, you're causing extra inflammation in the skin. And then sometimes the way in which we put pressure on the pimple can actually push the bacteria down the follicle a little deeper. And so you're going to have the length of time in which that pimple hangs around is longer. So ideally, we would never touch them. But as a fellow picker myself, I know that is extremely challenging.
If you never touched it, what would happen? Because I'm thinking like, I got to get the pus out. Will it naturally kind of like pop and
it should? Yeah.
Yummy.
You can do warm compresses to try and expedite that process, but ideally it would do it on its own.
Okay. So sometimes what I will do that was not told to me by a medical professional is I will pop my pimples and then I'll put a pimple patch on them. I wonder if a better solution is like to put a pimple patch on again to prevent picking. Maybe that doesn't expedite the process or anything, but it just kind of leaves it there, lets it do its thing.
Exactly.
Okay. That is hard.
Yeah.
That's hard.
It's so hard.
It's self-control.
Do you know any like timeline for how long pimples take to manage like on their own? Because maybe that would be helpful. Like if I was like, this is going to be better by tomorrow, like it's going to be better if I just don't touch it. Because for me, I'm like, I've got to pop this pimple for that event I have tomorrow night. Like I've got to get it handled before then. But it never, ever helps.
Yeah, I don't think I have a specific timeline. It's all dependent upon like how big is it, how deep does it go, and what is the component behind it. Yeah.
Bottom line, don't pop. Don't pick.
Don't touch them if you can.
Don't
It's so
pick.
hard though.
Okay, I think this is our final question for you. What is your ideal AM and PM skincare routine? Cut through the noise. Tell us what we need and what's BS, because there's a lot of products being blasted in our faces.
So many. And it's like so overwhelming. How do you know what's right and what's not right? I am of the mindset that the more simple, the better. If you were to give me a 20-step skincare routine, I'm sorry, but I'm just not going to do that day in and day out. Like that's something that's going to go on for 2 days and then I'm going to get tired of it. Like no one has time for that. So for me, simple is better. In the morning, I have a 3-step process. I cleanse my face with a gentle cleanser. I put on a vitamin C serum and then I put on my sunscreen moisturizer combo. And then in the evening, 3 steps as well. I wash with my gentle cleanser. I put on my tretinoin and then I put on a good thick moisturizer. And that is all I do. You could consider doing like a little nicotinamide or azelaic acid for your reds or browns in there as well if you really wanted to. But for me, I'm like, I'm going to let my tretinoin do all of that for me and just stick to my 3 steps in the morning and 3 steps at night.
Is there any,
Love to hear it.
like I have a sunscreen. Should I be putting that on before moisturizer or after? You mentioned that yours was combined, but what if they're separate?
I would put it on after your moisturizer in that case.
Okay.
It should be the last thing that goes on, especially if it is a mineral-based sunscreen, so like a zinc oxide or a titanium dioxide. Those physical sunscreens are sitting on that top layer of skin, and then the sun rays will come down and they'll reflect off. And so if you have things glued on top, you risk them not being as effective.
Oh my goodness. I was using moisturizer too in my mind, like pack it in, but that is good to know. What about a toner? Like I hear a lot of people using toners, which I don't even know what that means, but you don't use one.
I don't use one. And the reason I don't is because anything that I'm going to get in a toner, I'm already getting with my tretinoin. So toners are these like quick drying products that patients will oftentimes put on their face. They're usually an astringent of sorts. So they're kind of stripping the skin of its natural oil. And over time, that'll actually make your acne worse because your skin's going to overcompensate for that dryness that you're creating. Now, there are new fancy schmancy like hydrating toners, like a milky toner and things like that. If you like it and it feels good and you want to put it on your skin, then great, go for it. But in terms of like anti-aging and anti-acne benefits, there's not a whole lot there.
Okay.
It's so helpful to hear someone say simple is better because, I mean, you can easily spend like $200 or $300 a month on products because you think you need all of them. But it's nice to hear like your 3-step process. If you could only choose one of all your skin care products, what would it be?
100% hands down sunscreen. That is going to be the main factor that's going to prevent skin cancer, which is something that I see in clinic every single day. I don't want that if I can prevent it. And so sunscreen is my like number one absolute. I will not live without it.
Good to know. I'm writing it down.
I see billboards sometimes that your sunscreen is toxic or poisonous. How do you feel about that?
I will say that the data does not currently show that. So what we're seeing is sunscreens divided into 2 categories, right? You have your mineral-based or your physical sunscreens. Those are going to be zinc dioxide, titanium dioxide. Those are sitting atop the skin, reflecting the sun rays that come off. There's minimal absorption of that. Then you have your chemical-based sunscreens, which are oxybenzone, avobenzone. Those are absorbed within the skin, and then the sun rays will come down, touch the skin, and those molecules will absorb the UV rays so that it can't penetrate deeper and cause skin cancer. There are preliminary studies or studies out there that show that avobenzone, oxybenzone have been seen in plasma levels, so within the blood, after appropriate use. Now remember, appropriate use is a full shot-sized glass of sunscreen for your full face. So it's a lot more than what most people are doing.
Yeah.
We have seen that has been found in your blood levels. What I will say is there's no current data out there that proves causation of cancer with sunscreen use. Further data or further studies are needed to further investigate that because there are plasma levels. So my messaging to patients is always, if you're worried about that, then let's just stick with the zinc-based or titanium dioxide product. That way you're avoiding that while still getting your skin cancer prevention.
Yes, that's so good. Okay, and zinc is also good for so many things. So even if somehow some zinc was being absorbed, you said it sits on top usually as a barrier, but if some zinc was being absorbed, that's actually probably good. Like I take zinc supplements all the time, so
Exactly.
yeah. Okay,
I have
so
a question.
helpful.
Well, just even thinking about a moisturizer, like that needs to be non-comedogenic.
Yeah, so you want to make sure that whatever product you're putting on says non-comedogenic on the label. And then there are various like thicknesses of moisturizers. So super thin kind of gels like Neutrogena Hydro Boost is an example of that. And then a step up in hydration from that is going to be any kind of lotion. So something in a pump. Something in a pump is not as moisturizing as something in a jar because they have to water it down to get it to go through the pump. So the most moisturizing you're going to get is typically in a jar. And it's all just dependent upon your type of skin that you have, the climate in which you live, and what does your skin truly need at this moment in time. Another like quick little like thing for people, Chrissy, you mentioned that skincare is so expensive, and it absolutely is. It's outrageous. I don't understand it. But an area in which I am not going to be spending a lot of money on is my cleanser. If you are the person that wants the fancy schmancy $80 cleanser, go for it. No harm, no foul. But for me, it's only sitting on my skin for a maximum of 3 minutes if I'm doing my routine right. And then it's going down the drain. So that's not something that I'm going to be spending a lot of money on.
Are you saying we should be washing our face for 3 minutes?
You mean 2 minutes?
Really?
Yeah.
Mine's probably like 5 seconds. 1, 2, 3, 4, 5.
Yeah, most people don't wash their face for a long enough duration. 1 to 2 minutes is usually appropriate.
And is it like, it's like pretty gentle circles, right? Not
Yep,
like scrub,
gentle
scrub, scrub.
circles. Yeah, no, not too firm.
And you're using
No
a water
washcloth.
or oil based?
In the evenings, I will double cleanse first with an oil to get off all my makeup and then the water-based. But in the morning, since I haven't put any super oily products on before bed, I just do the gentle water-based cleanser.
Okay, I can't wait to try it.
I just learned so much. That was so helpful.
I know.
Go ahead.
One more question. I'm assuming
Okay.
makeup is just like not good for your skin, but is there non-comedogenic makeup or most of them going to be clogging your pores to a degree?
There are. At Sephora, the common brands that I'll recommend to patients, I think about the Rare Beauty line, the Say line, and then the Mare line are all proven to be non-comedogenic and shouldn't make your pores or your acne worse.
Wow.
Very
Okay.
helpful. Well, thank you so much, Shannon.
Yeah, thank you guys. I really appreciate it.
As a reminder, this podcast is for educational and entertainment purposes only and shouldn't constitute medical advice. Always talk to your healthcare provider directly for questions about your health.